Hello, this is Dr. Jeetan Bendor for Physician Perspectives. I'd like to talk about bone strength and bone density. This commentary in Kidney International is interesting. Bone strength more than just bone density. So, if you look at it, in 1990, a randomized placebo controlled trial of fluoride in women with postmenopausal osteoporosis documented a dramatic improvement in the spine bone mineral density, which steadily increased over 4 years, resulting in bone mineral density that was 35% greater than baseline. However, there were significantly more fractures in the fluoride group compared to the placebo group. Now, this is important because this study has been nearly forgotten, but it remains the most clear-cut evidence that bone density is not the same as bone strength. Vast majority of doctors do not recognize the limitations of bone density measurements. The bone density fails to predict bone failure in many clinical situations. With normal aging, the fracture rate increases more rapidly than the rate of bone loss. As well, patients with chronic kidney disease have increased fracture risk. Some of this is explained by low bone density, but in late stages of kidney or chronic kidney disease, the bone density does not explain the fracture risk as well as it does in people with normal kidneys. Thus, nephrologists must interpret bone density results with care. A decreasing bone density is usually an indication of increased fracture risk, but a normal or increasing bone density can be falsely reassuring. It is important to remember that bones can have poor bone quality. So, bone quality could be defined as the accumulation of aspects of bone that contribute to bone strength but are not measured by bone density. This will include the architectural structure of the bone at both microscopic and organ levels, and the material properties of the bone, such as crystal size, orientation, and linking of collagen fibrils, composition of bone minerals, and presence of cracks or micro damage. Composition of marrow spaces could also contribute to bone strength. The author concludes that in the future, studies of effects of bone treatments should include effects of both the quality of bone and the bone density, but the final focus must be on the incidence of fracture. This is my note. Bone density is only one facet of an optimal bone. Unfortunately, we do not have any commercially available measurement of bone strength or even a robust bone strain index or a BSI. We should expect that soon. Thank you.